Okay, we're going to talk about compression devices and ACE wraps. So let's talk about compression devices first. The two most common compression devices you might see are TED or anti-embolism stockings and Venadines or often referred to as SCDs, sequential compression devices. So I want to talk about TED stockings or anti-embolism stockings first. So remember, with each skill video, you're going to go in, you're going to identify your patient with two identifiers, name and date of birth and wristband. You're also going to wash your hands and complete aided. So I'm going to skip by that part so that we can get right to the skill at hand. So the first thing that you need to do when you want to apply anti-embolism stockings is you need to have an order for this. Now in long-term care settings, the order might actually be on your care cards or your card access. That might tell you what size and when the patient is to wear the TED stockings. In acute care settings at Rochester General Hospital, for example, you would then need to go to Care Connect and open up the chart. That would then tell you what the provider prefers for the patient to wear, whether it's continuous or just during the day. But that will give you a gauge on when to remove the TED stockings and how long to keep them on the patient. Most often in long-term care, you keep it on during the day and it gets removed with HS care or hour of sleep cares. And then they get rinsed out and hung to dry. In acute care settings, the patient could be wearing them for 24-hour periods. So the first thing you need to do is you need to identify the order. And that will help you, again, identify the client that you're assisting with this. Now, if it's a new sizing for TEDS, and even if there has been TEDS put on the patient previously, we need to size the patient first. Before I get into that, I want to talk about different types of TEDS. So there are what we call thigh-high TEDs, and you can see here there's an elastic band, and the TED is extremely long. And I will also pass this out in class. So it goes all the way up to the thigh of the patient. These are often put on patients who are going to the operating room or post-op patients, maybe who've had some ortho surgeries. So you might see the order for thigh-high stocking as opposed to what's called the knee-high stocking, which is certainly much shorter, and it's only meant to go up to the knee, not over the knee. And we'll talk about that in a second. So I said we were going to talk about how to size the patient. So what I'm going to do is I'm going to put the camera down on our patient's leg here, so you can see her leg. And what I always recommend first is putting on gloves, because you don't know whether or not the patient has cellulitis or an infection of the leg, if they have any weeping or fluid coming out of the leg, which is called edema, because these are some of the reasons why we would apply a TED stocking to begin with, to help promote circulation. So I always recommend putting on gloves prior to applying TED stockings. So certainly before you put on the stockings, you need to look at the extremity, make sure the color looks appropriate, it's pink, you're getting good CMSs. So remember, C stands for circulation. We can tell circulation by the color of the extremity. This patient's extremity looks great. M is motion, so we would ask the patient to move, and they move fine. And S is sensation, so I might either take a cold alcohol prep and go, can you feel this? Or I would take my finger and say, can you feel me touching you here? I also want to do capillary refill, so I would go ahead and push down on the toe bed and looking for that refill within 3 seconds. So that's first and foremost. You can't do a proper reassessment of the TEDS if you don't do an initial assessment. So then we're going to actually measure the patient. And I'm going to hand this out in lab because you can't see it on the video, but this is a sizing chart. These come in all the TED stockings. So in order to size the patient appropriately, we have to make sure that we have a measuring tape. And in some packages, they come with measuring device as well. But here I have a little measuring device. So I'm going to use this. What you need to first measure is the widest part of the calf. So I would then wrap this around. This becomes hard because Miss Potts does not bend her legs. But I would then measure, okay, I got 14 inches. Okay, then I'm going to measure the length. So I want to start under the knee. Remember, we don't want it to go over the knee, all the way down the leg. And that's going to give me my length. So on the chart, you're going to have size, so small, medium, large, or extra large. And then you're going to have length. So regular, long, long. So you need to know that information because not everybody is the same size. So you need to measure first, and we're completed that, and then we're going to go over and get the appropriate package that fits the patient. If you have a compression stocking that's too tight, I want you to think about what that might do to the patient. So think about that critically. If you have a compression device that's too small, then think about what that would achieve for the patient. So that's just a couple things for you to sort of think through. And I may ask you again in Skills Lab. So then you're going to want to open up the package, and on the very bottom of the package you'll see this hole. Now that's there for a purpose. That serves a purpose. What you're going to do is you're going to take your hand and you're going to insert it into the TED stocking until you get that hole sort of on top where your palm is in your hand. And then you're going to undo it. So you're going backwards now. Keeping in mind where that hole is. It's right here. That's going to help me. So now I'm going to take it off my hand here. And that's going to help me put it on the patient. So that hole is then going to go on the bottom of the patient's foot. This is really hard to do with a mannequin. I will try. And then you would reach in, and this isn't going to work with my mannequin because it sticks to the plastic skin, but then you would reach in this way, and you would gently grasp the toes, and you would slide everything forward. And then you're able to go up and around the leg, but it's too hard for me to do with my patient here. And as you can see, the hole is on the bottom, and then the top fits perfectly where the bed should go. And there's if I were able to pull this all the way on, which is too hard, there's actually a spot there for the heel of the patient as well. So this hole is actually going to be what you're going to use in order to do post-compression device placement, CMS checks. So we did that before we put the device on. Now we can do it after. And that's really to make sure that the device isn't too tight, that the patient's tolerating it appropriately. So again, you would do your circulation. How does the skin look? Is it blue? That would be a clear indication that maybe there are some circulatory issues. Sensation and movement for the patient. We can also do capillary refill by just pulling that hole down. We're also going to make sure to ask the patient, do you have any numbness or tingling? That would be another clear indication that we need to remove the stocking. So to remove the stocking, you would just then pull down from the extremity and backwards out, gently. You don't want to have this stocking bunched up at the top. Remember, if we're using this for edema or swelling of the leg, we don't want it pinching into the skin. So it will make marks in the skin, and then we have skin integrity issues. So we want to make sure it is nice and smooth on the skin, that there's no wrinkles or rippling that can cause skin integrity issues. Another tip I always show people is if you're really struggling, especially when you've just bathed the person, or you're just struggling in general with it. Another great thing that you can do is you can take it and put on your hand like you would normally, like I just taught you. And if your patient does not have any respiratory issues, you then can give a nice generous amount of baby powder. That will help the piece to slide on a little bit better. So hopefully it will slide on your patient a little bit better. And like I said, this guy is just so hard to get it on. They're hard to get on anyway, but these are just a couple tricks that may help you a little bit with that. Okay, so that's knee high, and then as you can see here, this is how long thigh high would be, way up here, thigh right up to the thigh, and it has sort of a little compression around it so that it fits at the top. So then there are Venadines or SCDs. Many different people call them different names. It depends on what company produced them. So you may hear those interchangeably. These are actually, says right on it, Kendall SCDs. These would be measured as well and fitted on the patient. This side actually says ankle, so that would be the side that we're going to place to the patient's ankle. And fairly not too complicated, would wrap right around the calf. We're only measuring length now, unless we need a larger one due to calf size, but they're pretty generous in the size. And then you can see here there's this sort of piece hanging out the bottom. And that's what we're going to actually hook up to the machine. So let me bring this up towards the camera a little bit so you can see. You can see there's a little pointer piece here. That's going to fit in very nicely with the pointer piece on the actual stocking. The two will go together. They will click in, and then they'll be ready to put on the patient's extremity. Both lower extremities. You would then turn it on. There's a button right here in the corner, and that would turn it on. The device is fairly simple, although there may be times where you need to troubleshoot it. Maybe there's a leak in the tubing, but generally speaking, it's fairly simple. It would then sort of gently massage the legs one area at a time in order to promote venous return and move that blood back up to the heart so we don't have any clotting. Compression devices like SCDs actually are usually put on in acute care facilities, or they could be in some long-term care rehab facilities, and they're generally put on at night Although some providers may ask if a patient is bedridden to wear them 24 hours a day. And then again, some patients may have them up while they're out of bed. So as we think, like nurses, we have to think, well, if we've got this cord attached to the patient, we have to think about what that puts the patient at risk for. So if this patient gets tangled up into these cords trying to get out of bed, we know that we're looking at a fall risk for this patient. So you have to always be thinking about that and whether or not it would be safe for that patient to wear at that time. And communicating that with the provider. The last piece that we're going to cover is ACE wraps. And ACE wraps really are beneficial for a lot of patients, especially patients who are so edematous on their extremity that a TED stocking or a compression device would not work for them, as it would be too tight and uncomfortable. So the biggest and most important thing you want to remember with ACE wraps is you're always going to start on the lower extremity, and you're going to start working your way up from there. You never want to start at the upper part of the extremity and work your way down, because you will actually cause all that fluid that was up here to end up in the foot. And that can cause harm to the patient's vasculature. So we want to overlap about a ½ an inch to an inch. We want it a fairly good compression, but enough that we can put our finger between the ACE wrap and the patient's extremity. Too much compression, again, can cause problems with the patient's circulation. Generally speaking, I leave out the heel. I think this is a good opportunity for me to be able to assess the heel. But if the patient really has a lot of edema, then you can certainly go over the heel. And then you would continue wrapping up the leg. Again, overlapping at about an inch to a ½ an inch. Just like with the TED stockings, we're also going to make sure that we assess CMS and our capillary refill before we apply this. So then the biggest thing is with a TED stocking, or an ACE wrap, I'm sorry, is you get these little metal clips that come in there with them. You don't want to put these on the patient. And that's because the back of the metal clip has these prongs that are very, very, very pointy and very sharp. These can actually go into the patient's skin. Typically their skin is fragile and it can cause a wound. So we do not want to use those. What we're actually going to have you use is a piece of tape that would be date, time, and initialed. So you want to make sure you have that piece of tape ready with the date, time, and initial for the patient. The only other thing I want to make sure that I cover with you is making sure that if you were to have a patient with an amputated extremity, that you would almost do it, especially if it's a fresh amputation. And let me just pull this off and I'll show you how we get it off. We just kind of wrap around the patient. And you may need somebody to help you hold the leg of the patient, especially if it's really, really edematous or filled with fluid. So then, if you're wrapping a stump or a fresh amputation, especially above or below the knee, you would then want to do it in a figure 8 motion. So it's going to be hard to show on my hand, but it's something we could certainly practice in lab. You would then do a figure 8. Excuse me. And this is again, really hard to show, but it would be a figure 8 motion. It would have to be fairly tight so that the stump would then have time to recede, and it would decrease the swelling of that stump. So that would be something that you may have to wrap, especially if you're on a vascular floor. Okay, finally I'm going to go ahead and I'm going to leave my patient. Again, remembering my 3 safety pieces. I put her bed up, so I would then put her bed down, make sure she had her call light. I would then go ahead and ask her if she had or needed anything else. And then I would go ahead and leave the room. So you want to make sure your patient's safe before you go, and that they don't need anything else. And that is ACE wraps and compression devices.